So in today's class, we can talk about the complications of diabetes mellitus. Okay, so there are two types of complications: acute, chronic. Now, acute complications or chronic complications, as the word suggests, acute for a short period of time, chronic goes for a long period of time. When acute cases can be reasons of diabetic ketoacidosis or coma, infections, and many more. But for chronic cases, could be of end organ involvement, which involves the organ systems such as kidney, blood vessels, heart, eyes, even the nerves. So today we'll talk about diabetic ketoacidosis. So when in diabetic ketoacidosis, we can say that when the body's requirement for insulin are likely to increase because of a severe infection, fever, or emotional stress, the sugar in the blood vessels gets really high. At this stage, the body cannot use glucose for energy, so fat that is stored are mobilized and used, and ketones are formed. In short, if this is the body, in the body itself, the blood vessels has high sugar content. And because of that, the cells lack glucose due to low insulin. So they use an alternative pathway by using the fats. By using the fats, what happens is the ketones gets formed. And once ketones is formed, shows metabolic ketoacidosis. That's in short of what really happens. But what are the symptoms? First is nausea, vomiting, and abdominal pain. Second, fast and deep breathing. Third is extreme weakness and drowsiness. These are the main symptoms. One key feature or the hallmark feature is acid breathing. What can we see is a fruity, sweet breath. So, how do you diagnose this? Basically, we take a urine sample test, and the urine test presence of ketones proves our point. We use a chemical test known as test tape to find out. So, how do we treat this? Treatment is make sure you increase the insulin dose by 20 to 30%. Second, drink fluids. Get your urine tested by presence of ketone. These are the three things we have to match. Now, second cause is infections. In infections, what should we know? Well, reason for an infection to take place in a diabetic patient is first point, high blood glucose shows a good medium for bacterial growth. Second point, an immunocompromised patient, that is a diabetic patient, decreases immunity. The third point is infections tend to develop in complications of DM. Now, what kind of infections do take place? Skin infections, periodontal infections, TB, even malignancy, which is quite rare. Now we talk about the chronic complications. We said that the chronic complications such as end organ involvement, that could be vascular causes and neurological causes. Now let's talk about the vascular causes. Vascular causes, first we can divide this into three places: large vessels, medium blood vessels, and small blood vessels. While in large blood vessels, we are familiar with the term arteriosclerosis. Basically, in the blood vessel, fatty deposition takes place, known as plaque, gets formed. Soon they occlude the artery, leads to a heart attack, a medical term myocardial infarction. In cases of high blood pressure, when blood flows, turbulent blood flows, tends to erode the epithelium and endothelium of the blood vessels, leading to plaque or deposition of fatty tissues. Can lead to atherosclerosis formation. Well, in small blood vessels, affect the eyes and the kidney. In kidney, what all happens? There will be leakage of albumin, that is proteins, and also in chronic cases, acute kidney failure. Well, eyes, cataract plus glaucoma in the earlier stages, and also we can also see diabetic retinopathy. Now, diabetic retinopathy can be from presence of a microscope will show hemorrhages and exudate formations. Thank you for today's class. We will discuss later.